Kinetic Acupuncture. Acupuncture plus movement based on anatomy and kinesiology. Dr. Hyung-Suk Choi, creator of Kinetic Acupuncture. His books are available on Amazon.com. Kinetic acupuncture is one of the acupuncture techniques combined with movement, but several differences are there. Kinetic acupuncture has its own unique principles based on modern anatomy and kinesiology. Kinetic acupuncture is solution-focused treatment. Treatment session is constant repeat of assessment and intervention using treatment unit, acupuncture plus movement. Kinetic acupuncture is indicated and best for muscle-originated acute and chronic pain, lower back pain, muscle sprain, strain, spasms, cramps, any joint or limb pain, motor weakness by nerve pathology, spinal injuries, foot drop, acute, chronic, limited range of motion, frozen shoulder, aftermath of long-term immobilization. This is movement. This particular technique in this picture is Dr. Choi and another clinician at Samra University, where they're lifting the patient under the elbows, and he has needles in his spine that you cannot see, and we march him around the clinic. By lifting the patient up under the shoulders, they're providing a form of decompression of the spine. The back is being dropped, and he's walking with the needles in place, positioned at do 4 and do 16. There may also be needles placed at large intestine 11 and large intestine 4. This particular technique with walking is movement to align the spine to correct form, to strengthen and release the back muscles. And if you refer back to the beginning of this video from Samra brochure, this is the march that we do the patients, where they march as if they're marching in an army. They lift their legs up high. They're swinging the arms in the opposite direction of the legs, or opposite arm, opposite leg. They're walking straight and tall with needles in place. So this is a technique of kinetic acupuncture for lower back pain. Kinetic acupuncture is a solution-focused approach. Kinetic acupuncture is based on the belief that the patient heals themselves. By aiding proper functional recovery, acupuncture with movement accelerates the healing process. The kinetic acupuncture practitioner applies the treatment unit, sees the response, and intervenes again. Its depiction is like a conversation with the patient. Working closely with the patient in active and passive exercise, the kinetic acupuncture practitioner assesses and refines the needle placement and therapy based upon feedback from the patient and the physiokinetic response. This is the foundation of the treatment plan triangle depicted later coming soon, very soon in this video. Now, kinetic acupuncture. Kinetic pertains to movement of joint, limb, neck, or torso. Korean kinetic acupuncture is kinetic movement with acupuncture. VST acupuncture is a muscle twitch trigger point release technique for the neck and lower back vertexes. And trigger point can also be used on the knee and other muscles, the shoulders, and a lot of times on the knee. VST, and so VST is a muscle twitch response, but Korean kinetic acupuncture is also a trigger point release technique. However, it is not focused on achieving just the muscle twitch response, although there is that, and when we do the knee treatment, we may do twitch response with movement. Instead, the trigger point is released through the isometric stretching exercises performed while needles are in place. Korean kinetic acupuncture is performed upon the joints, limbs, shoulders, elbows, wrist, feet, knee, and hips. Now, keep in mind, for purposes of this video, I'm going to be focusing on the kinetic acupuncture with muscle isometric stretching exercises. Now, Dr. Choi, in his book, he does also joint work where he does mobilization techniques that he's mobilizing the joint without doing some necessarily stretching techniques. So I'm not going to be doing that kinetic acupuncture technique here in this video. We're going to be focusing mostly on muscle trigger point, muscle stretching, muscle releasing technique. But if you go to his books, you'll see some other kind of joint play exercises. So the stretching, isometric resistance stretching. For treatment of joints, limbs, isometric stretching of targeted muscle may be the primary kinetic application with acupuncture. The targeted muscle will be stretched. In the stretched position, the practitioner will add resistance as the patient is um, instructed to contract their muscle to move the joint or limb against the resistance of the practitioner. As the muscle contracts but is unable to move the joint or limb due to resistance, the muscle will stretch. The needles will remain inserted to the trigger points during the isometric stretch activity. The movement of the needle in the trigger point will facilitate a release and relaxation of the muscle, thereby achieving better range of motion and pain relief. So, got some cautions ahead in red because we have to practice acupuncture safely, of course, and trained acupuncturists are very responsible, but hopefully everybody watching this video is properly trained. But there can be improperly trained, unqualified acupuncturists that can harm their patient. So don't overstretch. Don't stretch beyond the patient's comfort level. Stretch to the point of muscle resistance, but not much beyond. Stretching is going to be the answer. Much of the mechanism of muscle trigger point pathology can be answered by stretching the muscle. With the activation of acupuncture, Korean kinetic acupuncture offers a superior way to stretch the muscles. The principles of acupuncture physiology offer a superior way for patients to remain in good health with pliable, flexible muscles and overall good health. Um, Outside of the clinic, the self-stretching exercises in the Fountain of Youth stretching series also offer a good way to remain pain-free. The treatment plan triangle. You'll see this triangle. You'll see it's divided into 3 sections. On the bottom section is Korean kinetic acupuncture. In the middle section is VST, and on the top is Sa'am acupuncture. This is what Dr. Choi refers to as the solution-based approach of kinetic acupuncture. So for instructions on the treatment plan triangle, when we look at the base of the triangle, that's going to be the first technique performed on the patient, and then you work your way up to the next technique, and then the next technique, and at the top would be the next technique. So we start at the base of the triangle and work our way up. This is the order of procedures. The treatment plan triangle represents the order of procedures to be performed during each treatment. This treatment plan triangle represents a Korean kinetic acupuncture procedure done first, followed by VST acupuncture, followed by Sa'am acupuncture. Kinetic acupuncture and VST are always performed separately because kinetic acupuncture involves movement, exercise, and activity while the needles are in place, while VST acupuncture is performed stationary and passively. VST can be used alone or combined at the same time with the Sa'am acupuncture or whatever procedure the licensed acupuncturist prefers. Various types of mobilization techniques and stretches will be included in the treatment plan triangle, depending on the condition being treated. Other suggestions may fall outside the triangle, such as moxibustion, gua sha, or other techniques a practitioner has expertise in. These will be labeled as practitioner choice within the treatment plan triangle. There will also be self-stretch recommendations for the patient to do at home based upon my Fountain of Youth Muscle Stretch book series. The practitioner will want to acquaint themselves with those materials as they provide integral insight and practice into these Korean kinetic acupuncture techniques. And we do Tuina mobilization techniques as part of Korean kinetic acupuncture. Tuina mobilization techniques are vitally incorporated into VST and Korean kinetic acupuncture for the neck, which we call TCT, Therapeutical Cervical Technique. And there's 4 different ones that I practice. And then there's the lower back treatment and we use TLT or Therapeutic Lumbar Technique, which is just one. It's a needle into the quadratus lumborum muscle while the patient's lying on their side. It's a perpendicular insertion located at due 4, which is on the L2, L1 vertebrae area. And this technique was seen by Dr. Jonghwa Lee in the VST clinical video series. But this technique can target the psoas muscle and the quadratus lumborum. So after doing the needle, then we just do a gentle back stretch with our patient. We will demonstrate these techniques to the best of our ability in our videos. Dr. Evan Mahoney, Fountain of Youth Stretching, also incorporated with VST and Kinetic Acupuncture, are the Fountain of Youth stretches, especially with Kinetic Acupuncture. After a procedure is performed, I usually follow up with a Fountain of Youth stretch. Most of these stretches are found in my stretching book series and will be demonstrated in this video. In the treatment plan triangle, if Kinetic Acupuncture is named, it will usually imply that the Fountain of Youth stretching is also performed within that same section of the treatment plan triangle. And my 2 books, Dr. Evan Mahoney, Fountain of Youth Stretching, and Eliminate Back Pain Hang from a Tree, are available on Amazon and other online retailers. Isometric stretching. What is isometric stretching? Well, right now I'm stretching my biceps muscle. This biceps muscle is stretched. My arm is extended and it's stretched. Now, isometric exercise is when the practitioner will hold the muscle and the patient is instructed to flex the arm, but the practitioner will add resistance. So I'm flexing my arm, the biceps muscle is contracting to flex the arm, but the practitioner holds the arm in place to resist that motion. Thereby, the muscle is contracting to move the arm, but the arm is not moving. So the only option is that muscle stretches. It's an isometric stretch. It's a stretching exercise done with resistance. Now, for purposes of this video and kinetic acupuncture, we would be doing needles in the biceps muscle on the trigger points, anywhere along the muscle. We put needles in there and then we do the isometric contraction against resistance. And by doing that, the needles will help to release the trigger point, untie the knots out of the muscle, relax the muscle, lengthen the muscle, and stretch the muscle. That's the purpose of kinetic acupuncture, which also thereby aligns the joint, the proper joint alignment to prevent the worsening development of arthritic conditions, eliminate pain, eliminate tendonitis pain, localized pain, inflammation, swelling. So the purpose is to stretch the muscle with the acupuncture needles in place. We will be doing many demonstrations of this with the joints and the limbs, and that's going to be coming up very soon. The first video will be a peripheral nerve impingement that we investigate coming from the shoulder. Is it the neck? Is it the shoulder? Going down the arms, tingling in the fingertips, and numbness in the fingertips. So we're going to be investigating a peripheral nerve impingement case with numbness and tingling going down the fingertips and hands. And we will be doing kinetic acupuncture procedures to both treat and also diagnose in cases of peripheral nerve impingement. The diagnosis, basically, if you can stretch your way out of pain, the diagnosis, number one, it's not a spinal related disorder. It's a peripheral nerve impingement coming from some muscle somewhere. It's a much more favorable diagnosis than having a spinal nerve impingement from bulging disc, stenosis, um, whatnot. So it's a great diagnostic tool. In regards to peripheral nerve impingement, you get better with stretching, then stretching's the answer, and it's not a serious problem. you can give your patients a great peace of mind with this, because a lot of times they've been diagnosed with the worst diagnosis. Sometimes surgery is recommended, and then they come to you, and you stretch on the first 5 minutes. You're stretching their way out of numbness and tingling, and it just is a huge relief for the patient, and they will very much appreciate you and have great confidence in your skills and abilities of performing acupuncture. Korean kinetic acupuncture for disorders of the hands, wrist, and fingers. Common disorders of the hand, wrist, and tendon: tendinitis, pain, numbness, joint deformity, swelling, limited range of motion, Raynaud's syndrome, which is when the fingers turn white when it gets cold. We talk about cold a lot, and anybody with Raynaud's, you want to just advise them against cold, and the muscle shortening syndrome that we've talked about. Cold exasperates muscle shortening syndrome. Dupree syndrome and trigger finger are also common disorders of the hands, wrist, and tendon. In cases of numbness of the hands, wrist, and fingers, or pain that radiates from the neck, shoulder, arm to the hands, wrist, and fingers, an extensive intake will have to be performed. The practitioner will have to determine if the cause is due to a central or peripheral nerve impingement syndrome. If it is of a central nerve impingement, then there should be an accompanying complaint of neck or shoulder pain or a history of neck injury or disease. So, red flags here, especially radiating pain, numbness, or bilateral radiating pain, numbness, or if the patient is dropping objects held in hand, then it is likely a central nervous system syndrome. Immediate referral to a specialist for MRI, X-ray, or other imaging study is necessary. To be safe, if the patient has not been to another doctor, does not have a diagnosis, or has had no imaging studies prior to seeing you, then refer out for further imaging study if no improvement is made after the first treatment. So yes, give the treatment a try, see if you can make a difference on that first treatment, but don't hesitate to refer out when it's like, something with this central nervous cervical syndrome. Sometimes radiating pain or numbness is not of a serious disorder. Alleviation of these symptoms may disappear after the use of these techniques. If so, then the prognosis becomes more favorable. And when I say sometimes radiating pain or numbness is not of a serious disorder, this refers to peripheral nerve impingement. For a simultaneous neck, shoulder, wrist complaint, the practitioner will have to distinguish if there is a single event causing the symptoms, or if there are simultaneous processes affecting each part of the neck, arm, wrist individually. For instance, numbness to the wrist or fingers can be a peripheral nerve impingement occurring at the forearm, flexor, and extensor muscles. This is usually due to repetitive overuse of the hand and wrist in one's daily activities. It could be from a carpenter or laborer's use of a hammer or tool, too much time spent on the computer keyboard, mouse, or phone, or from sports activity. Cold could be a factor too. The patient may present with wrist, hand, finger numbness along with simultaneous neck, shoulder complaint. If so, then a multitude of techniques could be implemented, forming a treatment plan such as this treatment plan triangle, where the first treatment, which is at the base of the triangle, would involve Korean kinetic acupuncture, wrist, hand, and fingers. So we do these wrist, hand, and finger kinetic procedures, which you're going to see in a moment. And then you diagnose, oh, is the radiating numbness or tingling still in the hands? No, it has disappeared after doing these wrist techniques or after stretching. Then you know your diagnosis right there is peripheral nerve impingement. Now, if there's no change, then we go to then we would do VST on the neck and shoulder, and we see if we get relief on these radiating symptoms after the VST procedure, especially releasing maybe the infraspinatus, the teres major, and teres minor muscles, because they may still be peripherally pinging on the nerve from the shoulder or back of the shoulder there. Or it's the traps. Sometimes the traps impinge on the nerve. So after VST, are the symptoms of radiating pain or numbness gone? Good. That indicates peripheral nerve impingement. Okay, now if there is no change, still radiating, then they probably have some severe neck pain. Then we start thinking about a cervical disc problem, or some kind of spinal related issue. So also there's a Korean kinetic acupuncture for the shoulder that we can do, which oftentimes, even if there's still no improvement after VST, I do the shoulder triceps stretches, um, and sometimes that will get rid of the pain, and it's still in the peripheral nerve impingement syndrome. So basically, with peripheral nerve impingement, we can find whether it's from the forearm extensor flexor, coming from the shoulder rotator cuff muscles or the trapezius, do some stretches. And then, if there's no change after that, everything, then you suspect it's a more difficult case. This is a Choi progression analysis chart where it becomes a more difficult prognosis. Peripheral nerve impingement on the Choi progression analysis chart should be in the category A, should be pretty favorable, getting results in the first treatment. However, with these cervical disc impingements, that's going to be a more complicated, difficult prognosis. And you want to be honest with the patient. So this is the treatment plan triangle for the wrist hand numbness with simultaneous neck shoulder complaint. In this treatment plan, the practitioner will use the Korean kinetic acupuncture for wrist, hands, and fingers. The reason is to find out if the pain or numbness is alleviated after the use of this technique. If the pain or numbness recedes after the procedure has been formed, then the diagnosis is much more favorable towards being only a local peripheral nerve impingement. In this case, Korean kinetic acupuncture technique also becomes the diagnostic tool, which is very important. If no change to numbness or hands has been made, then Korean kinetic acupuncture for the elbow could be performed, which we'll do a golfer's elbow and tennis elbow video too. Essentially, the practitioner works their way from the distal to proximal of the neck and shoulder. If numbness has or has not receded after Korean kinetic procedure, then VST can be formed for the neck and shoulder. Re-examine again. Maybe Korean kinetic acupuncture for the shoulder will be performed afterwards. Do moxibustion. This is practitioner's choice. Moxibustion, mobilization, practitioner choice procedures. Re-examine the patient again. If there's still pain or numbness radiating to the wrist and hand, then it should be recommended MRI, X-ray, or other imaging study to find the diagnosis if none has been made prior. This example brings up some practical considerations for the Korean kinetic acupuncture procedures. These techniques may require more interaction with the patient, thus more time spent with the patient. The techniques can be intensive and physically demanding. The practitioner is working in close proximity to the patient. The push and pull techniques of resistance stretching require strength and leverage of the entire body, especially during kinetic shoulder procedure, calf muscle technique, and piriformis syndrome technique. Multiple procedures may be used. Modification of treatment plans may be required depending upon the type of business model you have and busyness of your clinic. Some patients may require multitude of procedures. Other cases, the problem will be resolved after a single kinetic procedure that only takes 5 or 10 minutes. Sometimes we may do too much for our patients, trying with one modality after the next to make an immediate difference. One can easily fall in this pattern because of the multitude of Korean kinetic acupuncture procedures and other techniques available. And this is where I fall into problems because I want to do everything. I'm one of those people. I want to do everything I can for my patient on that first treatment. So they come in with a neck, shoulder complaint, some hands, wrist pain or numbness, and then they get a knee problem also. So I end up doing like everything. I'll do the knee procedures and the hands, wrist, VST. I manage it well. I mean, that's what I'm here for. I want to do my best for every patient. I have a heart of service. That's what I pray for every day, that I may have a heart of service for my patients. And so that's just my model. And sometimes it is demanding a lot of work, but other times, yes, I tell them, okay, I can do this and this today, but I'm not going to be able to do the knee today. Come back for another time. And that would be a smart thing to do. So, with all these procedures, you have a lot of things and options that you can do. Okay, so here now is the treatment plan triangle for the pain of wrist, hands, and fingers. For general wrist, hand, and finger complaints such as tendonitis with pain still in the acute, subacute time period, the prognosis is most favorable. And that's the Choi and that progression analysis chart. they're in the subacute acute time with a muscle sprain or strain, a recent strain. So this is in the very most favorable category. Prior overuse of phone, computer, tools, hammers, whatnot may have been the cause, as cold can also be the cause. Cold air blowing on the hands in the car can often tighten up the muscles. They don't even realize it, air conditioning. So Korean kinetic acupuncture should provide almost immediate relief and lasting benefits. And this after years of practice. I mean, the patient comes with wrist, hand, and I know immediately I'm going to get them a good result, like within a couple of seconds of doing the examination. So I often promise them a very favorable prognosis, expecting them to get relief like within about 5 minutes. So it's really neat. And again, it's all about establishing your reputation and confidence and skill that the patient has sees in you. So that's what this Korean kinetic technique is for. It's like your reputations uh, and confidence. So the base of the triangle for the wrist, hands, and fingers is Korean kinetic acupuncture, flexion and extension of the wrist. And then after that, like the 5 minute procedure, you can do your practitioner's choice, whatever it is your regular acupuncture procedure may be. For them, I may do Saham acupuncture, a whole body treatment, not even necessarily focusing on the wrist after that successful Korean kinetic acupuncture procedure. So we are going to now go into extension and flexion of the wrist. So in this picture here, you're going to see the picture in the upper left, which is a flexion of the wrist, and in the top picture on the right, it's an extension. So my right hand on that picture is flexion. Normal wrist flexion is 70 to 90 degrees. Wrist extension, which is my left hand in the upper right picture, normal wrist extension is 65 to 85 degrees. The above pictures are the wrist and arm positions which we perform Korean kinetic acupuncture in. The needles will have been inserted prior to extending or flexing the wrist. So we will talk about that in just a moment. So if there's a limitation in extension or flexion, well, we end up doing both these techniques. So the anterior forearm, which is the medial side of the arm, with wrist extension and flexion, the anterior forearm, we're going to do wrist extension and then flexion. Korean kinetic acupuncture targeted muscle. The main wrist flexors The main wrist flexor muscles targeted with Korean acupuncture are flexor carpi radialis, palmaris longus, and flexor carpi ulmus, highlighted in pink in this photograph. These are on the medial side of the medial forearm. The brachioradialis, highlighted in green, is not a wrist flexor, but it is a muscle that we still can target and may want to target with Korean kinetic acupuncture. So this is the technique. The shortened muscles cause imbalance along the chain. By stretching the wrist flexors, we can accomplish stretching and releasing of the smaller flexor muscles of the hands and fingers. When the wrist flexors are shortened, the more tension is added to the attached tendons of the hand. This causes joint malalignment as well as additional tension to attach tendons and muscles further along the chain of the structure. And these would be arthritic developments or trigger finger, where joint malalignment due to short muscles, stretch tendon, over the long range of time, it's going to pull the joints out of alignment. There will be arthritic developments of bone on bone arthritic condition developments, calcification leading to arthritic developments. So joint malalignment due to shortened muscle will cause arthritis over the long period of time. In doing Korean kinetic acupuncture for wrist flexion, we will also be affecting the hand and fingers as well. So a benefit to the whole hand can be derived from this procedure. And here we go. Korean kinetic acupuncture, wrist flexion, the procedure. Now we're going to show a video. So this is just setting you up for the video here. Wrist flexion is the action taken while the wrist is in the extended position, done in the seated position with the practitioner and patient facing one another. So you find the trigger point, knotted areas of the wrist flexors. Extend the patient's hand, so you're going to bring their hand backwards with the stretches, which stretches the flexors. In the stretch position, the practitioner massages I use my 3 or 4 fingers. I massage in a distal to proximal direction with my 3 middle fingers firmly pressed against the patient's anterior forearm, the medial forearm. So their hand is extended. The practitioner runs their fingers up and they will find the tender areas, the trigger points. And remember, trigger point, almost by definition, is pain on palpation. You touch a muscle, there's pain. That's a confirmed diagnosis of trigger point. That's what we're looking for with this technique. You rub your fingers up the forearm, and the patient will say, "Oh, that's tender there." Okay, you feel the knot. You'll feel the knot with your finger. That's where you're going to stick a needle. Insert needles into trigger point areas of wrist flexors with a superficial 1.1 to zero point 0.3 chun. The patient's hand is not stretched, neither flexed nor extended during insertion of needles. So after I've located the trigger points, I straighten the hand out. I'm not extending it. We're going to insert the needles while the hand is just in a neutral position. We test the patient comfort level with the needles by moving the hand back and forth between flexion and extension. So we insert the needles and then you check. I tell the patient, okay, I'm going to check your comfort level. I'm just going to move your hand up and down. If the needles hurt, then I'll take them out a little bit. I take them out more. Or maybe I take them out all the way. So there, and also look for the dimple. The needle, there may be a dimpling in the skin, which is where the needle is inserted. And when you see that dimple, that will probably indicate a painful or uncomfortable needle position with movement. So I just take it out until the dimple in the skin disappears. So look for that dimple in the skin. Test patient comfort level with needles by moving the hand back and forth between flexion and extension. Adjust the needles outward if discomfort. Watch for the dimples surrounding the needle insertion area during movement. Dimple areas may indicate discomfort. Adjust the needle outward. Okay, so patient comfort with the needles has been assured with the test movement of the wrist. So we are going to begin isometric resistance. The patient's elbow is kept straight throughout this procedure. So straighten the elbow. The practitioner can use one hand if necessary to support the straightened elbow. The practitioner gently brings the patient's wrist and hand as far as comfortable in the extended position. So in the seated position with practitioner facing patient, the patient's arm is supine with fingers pointed towards the floor during extension of wrist. With the wrist in full extended stretch, the patient is instructed to flex the wrist and hand against resistance of the practitioner's hand, which is placed across the patient's palmar area. In the wrist extension picture above, the practitioner assumes the role of the right hand. In my picture, I'm holding my right hand as the hand is extended back. So I would be holding the hand of the patient extended back as the patient flexes, as the patient attempts to flex their hand against my own resistance of the practitioner. So then, to the practitioner's count of 4, the patient flexes their hand against the resistance of the practitioner. At 4, the patient is instructed to relax. The practitioner then returns the hand again to extended stretch as far as patient is comfortable. So you extend the hand back, and then as far as the patient is comfortable, and then you instruct them to lift the hand up, flex the hand against your resistance, and you count 1, 2, 3, 4, relax. So as they push forward, they'll move the hand a little bit, and then you ask them to relax, and then you return back to the extended stretch position as far as the patient's comfortable, and then you repeat the exercise 5 to 10 times. So each time you count 1, 2, 3, 4, relax, and then you return to stretch, and then you ask the patient to push the hand against your resistance. 1, 2, 3, 4, relax. This exercise is repeated 5 to 10 times. Remove the needles immediately upon the last isometric resistance stretch. Added for variation for finger complaints, trigger finger joint pain. So a lot of times the patient will point to painful areas in the fingers, in the joints of the fingers. Well, guess what? That's where you're going to do some acupuncture. So if the patient has a finger complaint, you will still begin with the wrist flexion procedure described above. Then with the needles retained in the hands and fingers as the patient is comfortable. The practitioner will be holding the resistance and resisting the patient's fingers. Ask the patient to flex their fingers against the practitioner's hand. This can be done individually upon each finger. So yeah, if the patient has a complaint of the joint or the finger, and after these wrist extension exercise, flexion exercises did not, then I actually do local acupuncture wherever they're pointing. If it's in the joint of the thumb, along the phalange, whatever joint, we'll do local acupuncture on the ashi point. And then I extend the hand back, and then I'm going to isolate each finger, and I'm going to extend the finger back even more. And then you can instruct the patient to flex each finger individually against your resistance. Okay, now we're going to go into wrist extension. For the posterior forearm wrist extension, the Korean Kinetic Acupuncture targeted muscles. The main wrist extensor muscles are targeted with Korean kinetic acupuncture are extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum communis, highlighted in pink in the photograph. Extensor carpi ulnaris, highlighted in green, is not necessarily an extensor. The procedure can help with conditions at the elbow, such as tennis elbow, affecting the lateral epicondyle of the humerus, which is the attachment point for extensor carpi radialis brevis, used in combination with the Korean kinetic acupuncture procedure. Korean kinetic acupuncture, wrist extension, the procedure, done in the seated position with the practitioner and patient facing one another. And I do this after having done the wrist flexion. I go right into extension. So, number one, find the trigger point on the knotted areas of the wrist extensors. So you flex the patient's hand, which stretches the extensors, done in the position demonstrated in the picture below. At the bottom there, I am flexing the hand, and then in the I'm going to massage, and then I'm going to massage in a distal to proximal direction with my three middle fingers firmly pressed against the patient's posterior forearm, looking for finding those tender trigger point areas, which are the ashi points, which are where we insert the needles into the trigger point areas of the wrist extensor. Again, just superficially 0.1 to 0.3 chun. The patient's hand is not stretched, neither flexed nor extended during insertion of the needle. So you find the trigger point, and then you straighten the hand to a neutral, unflexed, or unextended position. Then you insert the needles where you found the trigger points. And then you test the patient comfort level with the needles by moving the hand back and forth between flexion and extension. Adjust the needle outward if discomfort. Watch for dimples surrounding the needle insertion area during movement, because dimple areas may indicate discomfort, and so you adjust the needle outward. Patient comfort with the needles has been assured with test movement of the wrist, so you begin the isometric resistance. The patient's elbow is kept straight. Again, both flexion and extension, the elbow straight throughout the procedure. The practitioner can use one hand to support the straightened elbow. So the practitioner gently brings the patient's wrist and hand as far as comfortable in the flexed position, which is this picture below, with the wrist in full flexed stretch. The patient is instructed to extend the wrist and the hand against the resistance of practitioner's hand, which is placed across the patient's dorsal area of the hand. So in this wrist flexion picture above, the practitioner assumes the role of my right hand as it resists the patient's attempt to extend their hand. To the practitioner's count of 4, the patient extends their hand against the resistance of the practitioner. At 4, the patient is instructed to relax, and the practitioner returns the hand again to a flexed, stretched as far as patient is comfortable. So once again, you're flexing the hand and then the patient's instructed to lift their hands up to extend against your own resistance, the practitioner resistance. They count 1, 2, 3, 4, and then you relax and you return the hand back to fully flexed position as far as the patient is able and comfortable. And then you instruct them to extend the hand again, 1, 2, 3, 4, against your resistance, and then you return back to stretch. This exercise is repeated 5 to 10 times, and then remove the needles immediately upon the last isometric resistance stretch. And then at this time, you do your analysis. Is there still pain? Is there still numbness? So assess the patient after flexion extension procedures are finished. Ask them if they feel a difference. Ask them to move their wrist and arms, curl their fingers. They should have improved range of motion, less pain. Maybe a trigger finger is able to return to position more smoothly. If a difference has been made, it is a most favorable prognosis, likely the result of muscle tendon imbalance. After Korean kinetic acupuncture for both wrist extension and flexion has been completed, practitioner has their choice, has to treat the other condition. Now, I'm going to continue on with the fountain of youth stretching. So after doing this wrist flexion extension procedure with the needles, I also do a fountain of youth stretching with the patient, and that is assumed to be part of the base in the triangle, to be part of the Korean kinetic acupuncture. In this case, it's followed up by fountain of youth stretching, which we're going to show in the video next. So this next video will demonstrate the position and the technique. We're going to show one video demonstrating the position, the movement, the technique, and then we're going to show another video with needles in place, perform this technique. And following that, we're going to do the fountain of youth stretches. So we've got two videos on the procedure coming up next, one without needles, one with needles. And then following up, we're going to be doing a fountain of youth stretching of the wrist extensor and flexor. This is a video demonstration to support techniques and procedures used in the book Korean Kinetic Acupuncture, Acupuncture's Next Generation Muscle Trigger Point Technique by Dr. Evan Mahoney. In no way should this be used by those without completed education, license, and degree in the curriculum of acupuncture and oriental medicine. Further training is recommended before one should begin practicing these techniques. The author takes no responsibility for mistakes or medical errors caused by those practicing these techniques. This video will not have needle insertion demonstration. For purposes of this book, these techniques should only be used for complaints of pain unless otherwise stated. It is to be understood that the practitioner using these techniques has a full understanding of acupuncture safety, contraindications, and proper needle location and insertion depth. To find the trigger points, you stretch the muscles, you extend the hand back, you're stretching these muscles, and then you massage, and you find the tender points of the area. Right now I'm working on the flexor carpi radialis, the medial palmaris longus, and flexor carpi ulnaris. Now these are on the medial side. You can place needles here. There's some knots here and here, according to the instructions in the book. You may want to also place needles in the brachioradialis, although this is not a wrist flexion muscle. So once the needles are in, we do this exercise. The practitioner will extend the hand back, and they instruct the patient to lift the hand up at the count of 4. So go ahead, lift your hand up, 1, 2, 3, 4, relax. Lift your hand up, 1, 2, 3, 4, relax. Lift your hand up, 1, 2, 3, 4, relax. So the patient is lifting their hand up, they're contracting these muscles, but the practitioner resists that movement. These muscles contract to move the hand, but the hand doesn't move, so these muscles will stretch. You can repeat this exercise between 5 and 10 times. Now we'll work on the posterior forearm. We will stretch the muscles by flexing the hand. You can check for the trigger points. The trigger points are along the extensor carpi radialis longus, the extensor carpi radialis brevis, and then also on the lateral side is the carpi ulnaris lateralis. So you extend the hand down, find the trigger points here, here. You insert the needles according to the instructions in the book, and then you're going to instruct the patient to lift the hand up, but you're going to resist that motion. So lift the hand up, 1, 2, 3, 4, relax. Lift the hand up, 1, 2, 3, 4, relax. You can repeat this exercise 5 to 10 times. And again, these muscles contract to extend the hand. The practitioner is resisting that. These muscles contract, the hand doesn't move. It'll stretch the muscles and it'll eventually relax the tendons here, giving benefit to the hands and fingers. Okay, just right around here. Up more. Feel with the fingers and insert the needle. Good. Insert. Good. Feel with the fingers, palpate the muscles, the trigger points. Good. Insert. Good. Play around with it. She's feeling for the trigger points. Insert. Okay. Okay, very good. So we're working on the muscles here. Let's do the procedure. Now you can do needles all up and down, wherever you feel the trigger points in the arm. So we're going to extend the arm. Now, first thing, you can relax. Check, hold on to my arm. Check the patient's comfort with the needle. Hold up and down. Is it okay? Okay. Now go back down. Now fully flex the muscle as much as possible and then instruct the patient to lift their hand up, but the practitioner is going to resist. So I'm lifting up, lift up, resist. 1, 2, 3, 4, relax and return back to stretch. And then repeat, lift the hand up, 1, 2, 3, 4, relax, and then return back to stretch. You'll see the needles kind of moving. Okay, lift up, 1, 2, 3, 4, relax, and then lift up, 1, 2, 3, 4, relax. So this is an isometric stretch. We're stretching these muscles with the needles and the trigger points, and then we lift up. These muscles contract to lift the hand up, but she's not letting it. So the only option is my muscle is going to stretch here. Okay, we'll take the needles out. Okay, good. Now we're going to do extension of the arm on the medial side of the forearm. And let's go. Same procedure, just on the medial side, on the muscle trigger points here and here. Good. There's a little jump there. That was good. I don't know if you can see the needle there. There it is. You can see it against the chair. It's right there. This is my wife. She's a licensed acupuncturist. So make sure you are a licensed acupuncturist to do this procedure. Then the second needle is right there. You can see that there. There's 2 needles. Okay. 3 needles. You can see them. It's better that way. Okay, and then do a couple more on the inside of the arm. You'll see there on the lateral side and the medial side. We can do a couple there. A couple more. Wherever you feel the knots and the trigger points, you can do the acupuncture. She's going about 1 to 3 chun in 0.1 to 0.3 chun in depth. Very safe as long as it's on the muscles. And she's feeling for the trigger points, the knots. Okay, hold my hand next. Just hold my hand. Okay, so let's check the comfort level of the patient. You move the patient's hand up and down. Are they comfortable? Now, There's a little dimple here. I don't know if the camera picks it up. So it's a little painful maybe for the patient. So you just take it out a little bit. And I took that one up by accident. And if it hurts the patient, you can just take them out a little bit. Okay, but my comfort level with the needle is fine. So we're going to begin the kinetic acupuncture with an isometric stretch. We're stretching these arms. My hand is down. Now I'm going to lift up. You instruct the patient to lift up the hand, but the practitioner resist. 1, 2, 3, 4, relax, and then return back to full stretch. And then lift up. 1, 2, 3, 4, relax, and resist, and return to stretch. And then lift up against 1, 2, 3, 4, relax, and return back to stretch. And again, 1, 2, 3, 4, relax. So I can do this from 5 to 10 times per patient, per body part. Okay, that's good. So I'm going to take the needles out. And then following this, we do the fountain of youth stretching with the patient. And we're going to do the fountain of youth stretching, and I'm going to do a pull on the muscle while the muscle's in a stretch technique. We'll be doing that next. Just hold it. Okay, perfect. Okay, so we are doing the fountain of youth stretching for the lateral side of the forearm. We instruct the patient to lift their hand up and keep the elbows straight, bend the hand, and then with their other hand, they're going to pull up on the fingers there, pull up, but they're also pushing down here. So they're pushing down and pulling up. Now, while they're putting these muscles in a stretch, the practitioner can pull down on the muscles. Now, we can get the tennis elbow area here and just pull on the muscle. Do you feel a stretch? Okay, she feels a stretch. And you just pull on the muscle while it's in a stretch. So you put the muscle in a stretch, and then you pull down on that muscle. So this is a fountain of youth stretch. We recommend to do these stretches as a set of 2 to 3 times per set. And if the patient's doing it by themselves, just hold for 15 to 30 seconds. But the practitioner can further accentuate the stretch by pulling on the muscle when it's in a stretch. Let's do the other one just real quick, the other way. Okay, this is the fountain of youth stretching for the medial side of the hand. We're stretching the medial side, the inside of the hand, to benefit the wrist here and the fingers here. So what we're doing is we're going to bend down here, and then you have the patient lift the fingers up. Okay, good. Can you see that? And then we instruct our patients to hold this position. Their hand is just off the table. It's not completely on the table. They're pushing down here at the wrist as they're lifting up on the fingers there. And we're stretching these muscles here. Now, while they're doing that, I'm going to take my hands and pull on the muscle from underneath. So I'm pulling on the muscle from underneath here. And you can really grab, pulling on the muscle. Just kind of walk down. The muscle's in a stretch, and then you pull down and stretch. One other trick for arthritis, keep the position. For any arthritis on the fingers, you can have the patient press on the knuckles. They lift the finger up and then press on the knuckles, and this is good for arthritic developments of the fingers. You can feel you can feel the muscles stretching under the finger. So we're stretching these muscles, the medial side, to benefit the wrist and the fingers. This concludes the Korean kinetic and fountain of youth stretching procedures for the wrists, hands, and fingers. We're going to move up to the elbows next, and we will work on tennis elbow and golfer's elbow. Okay, so we are going to talk about Korean kinetic acupuncture for the treatment of tennis elbow, which is a pain on the lateral side of the elbow. And the primary muscles affecting that area are the brachialis and brachyradialis, which are the major targeted muscles for condition affecting the lateral elbow. The brachialis flexes the forearm, and the brachyradialis supinates the forearm. The primary complaint might be tennis elbow, which is also treated using the Korean Kinetic Acupuncture wrist extension procedure. That would be wrist flexion procedure. Okay, and the Korean Kinetic Acupuncture procedure for the elbow lateral side is done in the seated position with the practitioner and patient facing one another. The patient's arm will be pronated and slightly flexed upon a cushion sitting atop either the lap of the practitioner or patient. This is the stretched position for the brachialis brachioradialis. So number one is you find the trigger point, the knotted areas around the elbow. Basically, you're finding the ashi points here. There may not be so much evident a knot as just have the patient point where their pain is. Where their pain is the ashi point location. And then you will massage in a distal to proximal direction with 3 middle fingers firmly pressed against the patient's lateral elbow. Insert the needles into the trigger point areas of the brachialis brachioradialis with surrounding large intestine 11 and the surrounding areas, large intestine 10, 11, 12, superficial insertion 0.1 to 0.3 chun. The patient's arm is relaxed upon a cushion on the practitioner or patient's lap. Test the patient comfort level with the needles by moving the arm and elbow in a motion mimicking the backhand swing in tennis, flexion and supination of the forearm. Adjust the needle outward if discomfort. Watch for dimples surrounding the needle insertion area during the movement. Dimple areas may indicate discomfort, so adjust the needle outward. After the patient's comfort with needles has been assured with a test movement of the elbow, you can begin isometric resistance. Mimicking the movement of a backhand swing in tennis, the practitioner adds resistance across the back of the hand and arm as the patient tries to both flex and supinate the forearm. To the practitioner's count of 4, the patient tries to lift their forearm against the resistance of the practitioner. At the 4, the patient is instructed to relax. The practitioner returns the arm again to resting position upon the cushion. This exercise is repeated 5 to 10 times, and then after the exercise, remove the needles immediately upon the last isometric resistance stretch. So you're going to actually flex the hand, and in the flexed hand, you do the backhand swing against resistance. You're going to see this in the video. And then the treatment plan triangle for tennis elbow. The base of the triangle is Korean Kinetic Acupuncture. It involves flexion of the wrist and extension of the wrist. So it starts in the flexion position of the wrist, and the movement, the kinetic or the isometric stretch, the patient's not really, we're not asking them to extend the wrist. We put the wrist in flexion, but we have them do the backhand swing, which is contracting the brachialis, brachioradialis muscles that want to supinate the forearm. We're really resisting the supination exercise, so we're not resisting the extension. We're not asking them to extend the wrist. So we're starting the procedure with the flexion of the wrist, which you will see in the video coming up next. So the um, the next step is Korean Kinetic Acupuncture lateral elbow, and you can do after that procedure you can do practitioner's choice, which is I could do some acupuncture, large intestine channel with the liver channel. So this will be practitioner's choice. Here we go into the video of tennis elbow. This is a demonstration video for the book Korean Kinetic Acupuncture Techniques. Next we'll do some muscle release, trigger point release for the elbow. We will begin on the lateral posterior part of the elbow, with which the flexor and supinates muscles, which is primarily the brachioradialis and the brachialis. You can insert your needles, and you want to kind of put the muscle in a stretch here. You can insert the needles anywhere along the muscle here, and then you can ask the patient to supinate and flex the elbow. It's going to turn, it's kind of a backward arm swing in tennis, a backward tennis swing. So you're going to resist that motion. So go ahead and lift your arm up. 1, 2, 3, 4, relax. Return to the stretch position. 1, 2, 3, 4, relax. Return to the stretch position. 1, 3, 4, relax. So these muscles are contracting to flex and supinate, but you're resisting that, so these muscles will stretch. This can provide relief for tennis elbow. Okay, we are going to do tennis elbow demonstration with kinetic acupuncture. So most of the tennis elbow is on the brachial muscles here. So we're going to be going down a little bit on the line, but you can go a little bit above too. The patient usually has a complaint in this area here. So let's start with the LI 11, 12. Okay, go ahead and do the acupuncture. I can do it if you want. Okay.
This muscle?
Yeah, LI 11, 10. LI 11, 10. Good. You can see that muscle against my black shirt. There. That's on LI 11 approximately. We'll do LI 10. Good. Feels good. No pain. More around. You can do around then. You can, and then we'll be doing ashi points. This is LI 12. We can do local around the epicondyle. You can have the patient point, like where is it? There's some pain over here, say. You get it around that epicondyle. And again, you can go about 0.3 chun in. Okay, so we're going to check now. The needles are kind of around the area. Now what we're going to be doing is, I'm going to be doing two things. The first thing is, I want to stretch these muscles. So I'm going to bend my hand. I'm going to flex the hand like this. And then what we're going to be doing is like a backhanded tennis movement, where I'm going to be doing a backhanded swing against the resistance. And we can do it at different angles. Like I can lift my arm up here, or I can extend it more, but my hand is always going to be flexed. So my wife's going to be resisting. Hold it this way. She's bending the hand down. She's holding it down. And then I'm going to move up. 1, 2, 3, 4, relax. And then return to stretch. And then 1, 2, 3, 4, relax. Return to stretch. We can go up a little more elbow flexion. And then this way, don't push, resist. 1, 2, 3, 4, relax, and then go down and full stretch. Go ahead and push down. Or okay, now I'm going to pull up. 1, 2, 3, 4, relax. We can go from here. 1, 2, 3, 4, relax. We can almost extend it more. 1, 2, 3, 4. I'm pushing up and in. I'm backhanding my hand, and the elbow's flexed. And then the same stretch, the fountain of youth stretch that we did for the wrist and fingers, we can do the exact same stretch for tennis elbow. It's a really good stretch for both the wrist, the fingers, but also for tennis elbow. And keep the elbows straight, bend the hand, and then with their other hand, they're going to pull up on the fingers there, pull up, but they're also pushing down here. So they're pushing down and pulling up. Now, while they're putting these muscles in a stretch, the practitioner can pull down on the muscles. Now, we can get the tennis elbow area here and just pull on the muscle. Do you feel the stretch? Okay, she feels a stretch. And you just pull on the muscle while it's in a stretch. So you put the muscle in a stretch, and then you pull down on that muscle. So this is a fountain of youth stretch. We recommend to do these stretches as a set of 2 to 3 times per set. And if the patient's doing it by themselves, just hold for 15 to 30 seconds. But the practitioner can further accentuate the stretch by pulling on the muscle when it's in a stretch. This is the Korean kinetic acupuncture for elbow pain on the medial side, also known as golfer's elbow. The pronator teres is the primary muscle affecting the medial elbow. A primary complaint might be golfer's elbow, which affects the pronator teres and flexor carpi radialis and ulnaris, which were treated using the Korean Kinetic Acupuncture wrist flexion procedure. So for Korean Kinetic Acupuncture procedure for elbow on the medial side, it's done in the seated position with practitioner and patient facing one another. The patient's arm will be supinated and extended upon a cushion sitting atop the lap of either the practitioner or patient. This is the stretch position of pronator teres. Find the trigger point knotted areas around the elbow, and these will be around acupuncture point heart 3 area. So you massage your fingers, the practitioner massages the fingers in a distal to proximal direction, firmly pressed against the patient's medial elbow to find the trigger points. However, in this case, you can just have the patient also simply point where is the pain located. You'll see them point around the epicondyle, the bone there. But again, it is in the heart 3 area. So insert the needles into trigger point areas of pronator teres, acupuncture point heart 3, with a superficial 0.1 to 0.3 chun. The patient's arm is relaxed upon the cushion or on the practitioner or patient's lap. Test patient comfort level with the needles by moving the arm and elbow in a motion mimicking the motion of an arm wrestler, which is flexion and pronation of the forearm. Adjust the needle outward if there is discomfort. Once again, watch for any dimples surrounding the needle insertion area during the movement. This may indicate discomfort or pain, so you can adjust the needle outward. So once the patient comfort with the needles has been assured, after doing your test movements, then you can begin the isometric resistance exercises where you mimic the movement of an arm wrestler. So number one, also, I'm going to extend the patient's hand backwards during this procedure. So not only are you kind of arm wrestling, but you're going to extend the patient's hand backwards. So the practitioner adds resistance across the palm or hand wrist area as the patient tries to both flex and pronate the forearm. So once again, we're going to extend the hand, and then in that position, the patient's going to try to arm wrestle with you, but you're going to resist that. And you'll see this in the videos to come. To the practitioner's count of 4, the patient tries to lift their forearm against the resistance of the practitioner. At 4, the patient is instructed to relax, and then the practitioner will return the arm again to the resting position upon the cushion. This exercise is repeated 5 to 10 times. Remove the needles immediately upon the last isometric resistance stretch. And here's the treatment plan triangle. And the base of this triangle indicates that we could do the extension or flexion resistance of the wrist first. Okay, but nowadays I just go straight into point number 2, which is the Korean Kinetic Acupuncture of the medial elbow. And then what we do is we go back and we do the base of the triangle with the fountain of youth stretching. So nowadays I have this procedure kind of reversed. I will start with the Korean Kinetic Acupuncture of the medial elbow first, and then afterwards we will do the extension of the wrist or flexion with the fountain of youth stretching following the kinetic acupuncture. And you're going to see this order in the videos, which are as follows. On the medial side, we're going to work primarily with the pronatus muscle here, pronatus ternaris. This muscle pronates and flexes the arm this way. So this is kind of an arm wrestling. Keep the arm straight and then insert the needles here. And you're going to have the patient do like an arm wrestling motion, but you're going to resist that motion here. So go ahead and lift up. 1, 2, 3, 4, relax. Go ahead and lift up. 2, 3, 4, relax. Go ahead and lift up. 1, 2, 3, 4, relax. The patient's trying to do this. You can do it from different level. Go ahead and push in like that. 1, 2, 3, 4, relax. 1, 2, 3, 4, relax. This is to provide benefit to the medial side of the elbow for perhaps golfer's elbow. we're going to do golfer's elbow next. Golfer's elbow is kind of pain on the medial side of the elbow here. Tennis elbow is on the lateral side, but we're going to do the golfer's elbow. The patient has pain complaint in this area of the elbow. And we're going to do a kinetic procedure with this one. Good. Okay, go ahead. And she can do anywhere in the local ashi points. Heart. Okay. A lot of times patients will point to around the epicondyle there. So you can do it around the tendon areas there. Okay. Gently, good. Alrighty, good job. Maybe down here between the epicondyle of the elbow.
It's heart.
Heart 9 is right there. Heart 9's here. So we're almost on the small intestine channel there. Okay, that's good. Don't put it anymore. That's fine. Right there. Okay, and then how about right up here? I got some pain kind of on this side. We're going to be working mostly on these muscles here, actually, with golfer's elbow. Right there. Alrighty. Good job. Okay, we're going to do the kinetic procedure. So that's good. Okay, so my wife's going to take my hand. Now what we're going to do is extend the hand. We're really working on these muscles here, and we're going to arm wrestle. So she's going to extend my hand back as far as it goes, and then we're going to arm wrestle. And I'm going to push forward like that. 1, 2, 3, 4, relax, and then return back to stretch, and then push up. 1, 2, 3, 4, relax. And then my hand is extended. Now we can do different angles here too. I can lift up 1, 2, 3, 4, relax. And up and in, 1, 2, 3, 4, relax. So we are resisting the motion. 1, 2, 3, 4, relax. And then up and in, 1, 2, 3. So you can almost extend the arm very much and then go up and in, 3, 4, relax. And the hand is extended. Okay, 1, 2, 3, 4. I'm pushing up on the arm, but she's resisting. So we're contracting these muscles. We're stretching these muscles right now. And then I push, I contract these muscles, but the hand is not moving. So the only option is they should stretch there. 1, 2, 3, 4, relax. Okay, and the same fountain of youth stretch that we did for the wrist here also applies to the elbow. Down here at the wrist as they're lifting up on the fingers there. And we're stretching these muscles here. Now, while they're doing that, I'm going to take my hands and pull on the muscle from underneath. So I'm pulling on the muscle from underneath here. And you can really grab, pulling on the muscle. Okay. Let me pull down. Just kind of walk down. The muscle's in a stretch, and then you pull down and stretch. Video chapter for tennis and golfer's elbow with kinetic acupuncture. We are going to move on to the triceps next. This is the Korean kinetic acupuncture technique for triceps and elbow, which is an inability to fully flex the arm, and it usually manifests as pain at the elbow. Now also this kind of corresponds with a Teres major stretch, which we'll do in the fountain of youth stretching, because sometimes there is a peripheral nerve impingement that goes down the back of the arm that can affect the pinky finger, the ring finger, the middle finger. And this is kind of an on and off type of peripheral nerve impingement as opposed to cervical disc, cervical central nervous system impingement. So these peripheral nerve impingements down the back of the arm, you may want to consider to do the triceps along with teres major, teres minor, infraspinatus, which we do with the VST procedure, but then we do with the fountain of youth stretch you're going to see later for the triceps. So triceps, normal elbow flexion is 150 50 degrees. The forearm should touch the biceps. The inability to fully flex the elbow or pain at the posterior aspects of the elbow may be a result of muscle shortening of the triceps area. In the picture above, the forearm is flexed. The biceps are the agonist muscle initiating flexion, while the triceps are the antagonist inhibiting the action. With shortened triceps due to muscle trigger points, there will be a loss of range of motion and accompanying pain. The Korean Kinetic Acupuncture procedure for triceps and elbow. The picture above is exactly the position which the practitioner will want to insert the needles into the patient. Both the shoulder and forearm are flexed. So yes, make sure the shoulder is abducted and extended above the head and the ear. So bring both the shoulder and the triceps back. And this is the position from which we'll start the kinetic acupuncture procedure. In the picture below, you will see the trigger point areas in pink on the triceps, which will have the trigger points. And for the procedure itself, you will want to start with the forearm and shoulder fully flexed position. The triceps is fully stretched. Find the trigger point and the knotted areas on the triceps where you're going to massage in a distal to proximal direction from the elbow to the shoulder with the 3 middle fingers firmly pressed against the patient's triceps. Insert the needles into the trigger point areas of the triceps, superficial 0.1 to 0.3 chun. Test the patient comfort level with the needles by moving the patient's forearm in extension and flexion direction. Keep the shoulder flexed. Adjust the needle outward if discomfort. Watch for dimples surrounding the needle insertion area during movement. Dimple areas may indicate discomfort. Adjust the needle outward. Patient comfort with the needles has been assured with test movement of the forearm. So once the patient comfort level has been assured, you can begin the isometric resistance. Starting in the forearm and shoulder fully flexed position. Now, I tell people, pretend like you're going to be shooting a free throw in basketball. The practitioner instructs the patient to extend their forearm against the resistance of the practitioner. Practitioner's resisting hand is placed proximal to the patient's wrist. So, to the practitioner's count of 4, the patient tries to extend their forearm against the resistance of the practitioner. At 4, the patient is instructed to relax. The practitioner returns the forearm to the flexed position as far as the patient is comfortable with. The exercise is repeated 5 to 10 times, and then you can remove the needles immediately upon last isometric resistance stretch. And then following this procedure, you're going to do the fountain of youth stretch and pull on the muscle while the muscle's in a stretch, which we are going to show now in the videos.
Okay, this is Korean Kinetic Acupuncture sample demonstration video to support the book. This is a triceps procedure, which the triceps muscle is located here, and it extends the forearm. So if somebody has limitation on how much they're able to flex, it may be a result that the triceps muscles are short here, and it provides an inability to fully flex the arm. So for this procedure with the acupuncture, we begin by stretching the triceps, and then we're going to also flex the shoulder. The triceps is stretched. We check for tender area points here, and then you can insert the needles along those tender areas of the triceps. Once the needles are in, you're going to test the patient's comfort level by moving the arm. And once the patient comfort is assured, then you're going to ask them to lift their arm up like this, but you're going to resist that, and the triceps will contract to lift. But since you're resisting, the arm doesn't move, the triceps will stretch. So go ahead and lift your arm up 1, 2, 3, 4, relax. And keep the shoulder flexed, keep the triceps stretched. Lift the arm up. 1, 2, 3, 4, relax. Again, lift up. 1, 2, 3, 4, relax. Again, 1, 2, 3, 4, relax. You can repeat this exercise between 5 and 10 times, and then take out the needle.
Okay, we're going to do a triceps kinetic acupuncture procedure to stretch the triceps muscle. This is good for pain on the back of the elbow, where the tendons attach into the back of the elbow and they're stretched tight due to the short triceps. So we're going to clean the area. She's going to find the trigger points. You can see that needle right there. And you just find the trigger points all up and down the triceps, maybe one more. We can do 3 to 5 or 8 needles. Okay. Okay, next we're going to check the comfort level of the patient. You can have them move their arms. Grab hold of my arm. Stand over there. Grab down here. You gotta grab down here. Okay, so first just check the comfort level. Okay, feels good. So we're going to put the triceps muscle in a stretch. We're stretching the triceps muscle here, and then I'm going to push up my arm here, but she's going to resist. So push up 1, 2, 3, 4, relax, and return back to stretch. And you can also lift the arm up high above the head. And then from this high up position, push 1, 2, 3, 4, relax, and then return to stretch. Push up, 1, 2, 3, 4, relax. So when the elbow is high up, we're really stretching from here to there. 1, 2, 3, 4, relax. And then again, one more time. 1, 2, 3, 4, relax. And then we'll do the fountain of youth stretching next. Take the needles out. Okay. Okay, we're stretching the triceps with the fountain of youth stretch. You can pull on the muscle, so the patient's putting the triceps in a stretch, and then you just pull on the muscle while it's in a stretch. This is stretch number 1. This is the fountain of youth stretching for the triceps muscle. This is what we instruct our patients to do after we've done the treatment. This is good for triceps. This is good for the teres major. This is good for peripheral nerve impingements that come down the back of the arm to the hands and fingers. So this is a definite one for any kind of peripheral nerve impingement that goes down the back of the arm to the hands and fingers. So to simply stretch, touch the back, don't move, and just push against the wall. Push your arm against the wall so that the triceps is flush against the wall. And then just push against the wall. So this is the fountain of youth triceps and teres major muscle. Again, good for peripheral nerve impingements on the back of the shoulder, going down the hand, and triceps and elbow pain. This concludes the chapter on kinetic triceps procedure. Next, we will work on kinetic shoulder procedure, which includes VST, Vertex synchronizing technique of the neck. Okay, so we are doing VST acupuncture for the neck vertex. We're going to start on the trapezius muscle, and we are just going to work our way down. The trapezius muscle inserts into the back of the head here, and it's like a diamond-shaped muscle into here and then down to here. Any kind of pain on the back of the neck or headache pain is probably from muscle tension of the trapezius. So you insert the needle, and then you push and probe, and you just push and probe with the needle. And then we can do the all up and down the trapezius here. And then after doing the trapezius, we go into small intestine 13, and that's at the medial side the upper medial side of the scapula. This is the levator scapula muscle. You insert obliquely, not going too deep, 0.3 chun. With this, when you needle the trapezius, you can grab it with the fingers and you can needle between the fingers. And so you're not going to get a pneumothorax when you're needling on the trapezius, which is held between the fingers. And then you can push and probe with the needle. I leave the needles in after inserting. And so then we're going to move up to the first of the rotators, which is the supraspinatus here. I do an oblique insertion on the supraspinatus. And then the other rotator cuff muscles located here. This is infraspinatus. You can push and probe with this. We get a lot of muscle twitching over here, a lot of peripheral nerve impingements from pain going down the back of the arm, maybe from the infraspinatus, and also the teres minor, which is in line with the crevice where the armpit goes into the shoulder. We get a lot of muscle jumps and twitches on the teres minor muscle here. And then if you noticed an arm length difference, we can do teres major release, and you just grab the muscle between your fingers and you can go all up and down the teres major. There's one more shoulder rotator cuff that we can do, and that is the subscapularis muscle. And for that, you bring the arm back behind you. The scapula will wing up, and then you can insert the needle oblique, it's actual perpendicular, and go right under the shoulder blade there, and you're getting the subscapularis muscle. You can work your way all the way up from the lower to the upper shoulder blade. I do not retain these needles. This is a quick needle technique. And then after doing, we take out. So for the VST Vertex, we needled along the trapezius, levator scapula, infraspinatus, teres minor, subscapularis, for arm length difference, teres major. And then, of course, you can always do the traditional acupuncture points. We like to do GB20 and GB21, the urinary bladder point lines, small intestine lines, so you can incorporate VST with traditional acupuncture points. All right, this is the Korean kinetic acupuncture technique for the shoulder. Now, I'm going to start by looking at the treatment plan triangle. If you look at the base of the triangle, you're going to see VST acupuncture for neck and shoulder is what is performed first before the kinetic procedure is done. And then you're going to look above that and you're going to see a therapeutic cervical technique, TCT number 1, 2, 3, 4. And then above that, you're going to finally see the Korean kinetic acupuncture shoulder procedure with both kinetic movement procedures. And there's 2 kinetic movement procedures that we do with the shoulder. So when a patient comes in with neck and with shoulder complaint, I'm most often and fairly frequently or commonly doing a full neck and shoulder treatment, a comprehensive neck and shoulder treatment, because of the chain, the kinetic chain of muscles from the trapezius leading into the shoulder rotator cuff muscles. And most often there's an accompanying neck pain and tightness and stiffness. When you check the patient's range of motion, they do lateral bending, lateral rotation. They'll generally point, oh, I also have some tightness on the trapezius, maybe on the same side of the shoulder pain. So basically, I'm doing a very comprehensive neck and shoulder treatment. So with this treatment, we're doing the trigger point releasing techniques that we introduced in VST acupuncture, and we are doing the shoulder rotator cuff muscles, and this is where we can do the range of motion testing again for the shoulder. I'll introduce that one again, but we do the range of motion testing. We identify which muscles are short, which is causing maybe the arm length difference or the shoulder pain. And then we can do trigger point releasing, the VST trigger point releasing techniques of those muscles that we have identified. And then we will I like to do a cervical therapeutic cervical technique after that, lying in the face up position, which includes also a further stretch of it's a manual tweenus stretch of the trapezius. And then following that, we finally get into the kinetic acupuncture for shoulder. And so with the shoulder technique, the Korean kinetic acupuncture procedure for the shoulder does not specifically target muscle trigger points or specific muscles of the shoulder. This is because the companion technique, VST acupuncture, does provide for trigger point release of the four shoulder rotator cuff muscles, the deltoid and the neck muscles, also the teres major, the lats. So we are doing a comprehensive trigger point release done in the passive position with VST acupuncture. The Korean kinetic acupuncture procedure for the shoulder is the secondary procedure to VST neck. It uses a combination, practitioner's choice, of traditional acupuncture points, Sanjiao 14, large intestine 15, small intestine 9-10, and extra point Jiangqiang with shoulder movement and isometric resistance. Usually only 3 points are chosen, large intestine 15, Sanjiao 14, and Jiangqiang. These are all located in the picture above where the purple blue dots are on my shoulder. We would be inserting the needles, and these will be about a 0.3 chun, 0.1 to 0.3 chun depth. So normal shoulder flexion is 180 degrees. Normal shoulder extension is between 45 and 60 degrees. With the kinetic acupuncture procedure for the shoulder, we insert the needles into the acupuncture points, large intestine 15, Sanjiao 14, and Jiangqiang superficial. We test the patient comfort level with the needles by moving the patient's shoulder in extension and flexion direction. Patients should keep their shoulder relaxed. Adjust the needle outward if there is discomfort. Watch for dimples surrounding the needle insertion during movement. Dimple areas may indicate discomfort. Adjust the needle outward. Once the patient comfort with the needles has been assured with a test movement of the shoulder, we do kinetic movement number 1 for shoulder. The practitioner is holding the patient at the wrist and supporting at the shoulder. Gently rock the arm and shoulder in lateral and medial direction at the same time, moving the shoulder in flexion and extension up and down, no greater than 90 degrees in flexion and 50 degrees in extension. The gentle rocking motion in lateral medial plane can be achieved by the practitioner grip at the wrist. And then we move on to, and I do that for about a minute. Kinetic movement number 2, we begin the isometric resistance where the practitioner passively flexes the patient's shoulder to 180 degrees or as far as the patient is comfortably able to go. Practitioner then instructs the patient to extend and abduct their shoulder, pull down or retract the shoulder down against the resistance of the practitioner. The practitioner's resting hand is placed underneath the patient's elbow. To the practitioner's count of 4, the patient tries to pull down, retract, adduct, and extend their shoulder against the resistance of the practitioner. At 4, the patient is instructed to relax, and the practitioner returns the shoulder to the full flex position as far as the patient is comfortable with. This exercise is repeated 5 to 10 times. The shoulder is gently assisted to resting posture by the practitioner. Remove the needles immediately upon the last isometric exercise. So with this technique, as I fully flex the patient's arm above their head, I'm actually placing the shoulder muscles in a stretch, stretching the teres major. And so we're stretching the muscle and then they retract the shoulder down and it's a strengthening exercise. So this is both a stretch and a strengthening exercise. And my hands will be on top of the patient's shoulder and you can feel in cases of atrophy, when there's like a frozen shoulder that's been going on for quite some time, the muscles atrophy, and you can feel the tendons very stringy as you put your hands on the shoulder. You'll feel the tendons moving under your fingertips. This indicates like atrophy, instability of the shoulder. These tendons are pressing on the nerves. There could be extreme pain. So what we do is we do a stretch and a strengthen to help with strengthen the atrophic shoulder muscles, particularly the deltoid. In that exercise, it's mostly deltoids. We also get trigger points on the deltoids with shoulder pain. You'll find quite often getting trigger points on the deltoids themselves. And that again is done with the VST, done in the passive position. So we are going to show the video of this technique, and that will be the video next. TCT, Therapeutic Cervical Technique. We do 4 motions. Now, you're not going to see them very well. On the first one, actually, I have another video that demonstrates what we're doing much better than you can see here. But we're just pushing on the vertebrae side to side with our fingers, and we're walking up and down the vertebrae, the cervical vertebrae of the neck. You don't have to look at the camera. Just relax. Okay, and we just push side to side. Does it feel good? Don't make it run. Okay, push side to side, and then we can do it with our fingers, and we do pushing on each vertebrae. And you walk up and down the vertebrae. You're stepping up the vertebrae and down the vertebrae, side to side. And the most common of the TCTs that I do, therapeutical cervical techniques, is a stretch of the traps. And you just stabilize one hand on the shoulder, you turn your head, and then you don't push, just stabilize. And then you lift and turn, and you hold I hold for about 15 seconds. And then you do the other side, grab underneath, stabilize, you're not pushing, lifting up. I count to about 10 seconds. I like to repeat these. I do them twice. You're holding under and just stretching the traps. And then one more time. And then TCT number 4 is a neck traction, and you just pull. 1, 2, 3. 1, 2, 3. And then the last, actually TCT number 4 is when you have them rest the occiput on the fingertips, and you'll feel the suboccipitals just begin to melt like butter. So this is the last of the VCT. After doing VST for the neck, we do TCT, and then this is how we finish it. And the patient just relaxes their head, and they should feel the muscles begin to melt like butter under the fingertips. And insertion depth.
This is the Korean Kinetic Acupuncture sample demonstration video for a kinetic shoulder procedure. In this example, we do traditional acupuncture upon the points of the shoulder here. And while the points are inserted, we do a gentle rocking back of the shoulder. And we do this for about a minute, 30 seconds to a minute. The patient's shoulders relaxed. We're rocking the elbow laterally and medially as we also rotate the shoulder, flexion and extension. And then part 2 of this is we abduct the shoulder as far as the patient's comfortable. The needles are still in place. And then we instruct the patient to push down. Push down. 1, 2, 3, 4. Relax. We lift the shoulder up. Lift down, 1, 2, 3, 4, relax. We lift the shoulder up as far as the patient's comfortable, and then they push down gently against the resistance here. Push down, 1, 2, 3, 4, relax. You can repeat this about 5 to 10 times. 1, 2, 3, 4, relax. Gently lift the shoulder down again, and you can rock, and then take out the needles.
Okay, so I'm going to give you some bonus footage here on the TCT therapeutic cervical technique. This bonus footage is what I call the crazy neck stretch. And it's a decompression stretch of the neck that one can do themselves, but it utilizes the first therapeutic cervical technique where we're taking our fingers and pushing against the vertebrae, and we just walk in steps up and down the vertebrae, pushing side to side. So you'll get a good idea of this technique in the video. Now, regarding the video, I call it the crazy neck stretch because it's dangerous, and I make the warning in the video that you have to remember to breathe, otherwise you might pass out. So follow the instructions in the video. If you're going to do it, I don't advise it, but be careful doing it. Follow the instructions in the video. Make sure you breathe. And one thing is we like decompression stretches of the spine, especially when we get to the lower back with the kinetic hanging back stretch that we do. So we like decompression stretches of the spine, and the crazy neck stretch is a way that I have figured out how to do neck decompression, and I do it with the therapeutic cervical technique that we do on our patients. But again, the purpose of the video is to show you the movement of the fingers and the vertebrae pushing side to side, which we do on our patients. And this is therapeutic cervical technique number 1. So enjoy the video. I am Dr. Evan Mahoney, author of The Fountain of Youth Stretching. You can find my books available on Amazon or Smashwords.com. Alrighty. Hello, I am Dr. Evan Mahoney, and I'm going to show you a neck stretch that you can do yourself, and it involves decompression. Decompression is anti-gravity, separating the vertebrae. You can do it by yourself, but there is a big caution about this stretch. You may pass out, get faint, or dizzy, so this is not appropriate for anybody until you consult with your doctor about whether this is a safe neck stretch for you to do. So do not try this stretch on your own right now. Consult with your doctor because it may make you dizzy or pass out. So here we go. To position yourself, you squat down and you're going to rest your elbows on your legs, and then you take your arms and cradle them on your cheeks like this. So I'm going to get a little closer. Squat, cradle your arms, and what you're going to do is you're going to reach behind you with your fingers and you're going to push. That's what you're going to do. Are you getting that? Okay, did you get that? So you're using your fingers to push. So we're going to start by this, and then you just drop your head and relax. Then you position your hands and you just side to side. I'm going to do it from the side perspective now. Same thing. Let your head drop. Cradle your hands against your cheeks. Take a nice deep breath in. Breathing is very important. That whole time I was breathing very lightly. So you have to breathe. If you don't breathe, you will pass out or get lightheaded or dizzy. So be very cautious about that stretch. Consult with your doctor. But that was a decompression stretch of the neck cervical vertebrae. I hope you enjoyed. If you have any questions, you can contact me, Dr. Evan Mahoney. Thank you very much. Keep on Fountain of Youth stretching. This is another stretch we do after having done VST acupuncture. This is good also for peripheral nerve impingements, which go down the back of the arm from the infraspinatus, teres minor, triceps, or teres major. And also, this is good for the rhomboid stretch. So in the picture there, you'll see the X marking where the rhomboids are, which are located medial to the medial side scapula, between the scapula and the spine. So a lot of times, or when people come, sometimes they come with like a deep, local, focal pain that they want to scratch, and they try to scratch there, and it's located on this rhomboids, like right next to the scapula. So sometimes I do bleeding cupping, which gets rid of the problem. And, you just prick with a diabetic needle and do cupping, and that can help with that local focal area there. But also this stretch can sometimes target that area. Now, this stretch may depend on the angle that the patient is standing at. So you may want to position different angles with them, like stand a little higher or lower. But also this stretch stretches the infraspinatus, teres minor, teres major, and the triceps. So this is a good stretch to do also for those peripheral nerve impingements where the patient comes in indicating that they have some kind of radiating numbness or tingling, which travels down the back of the shoulder and the arm. And this stretch is one I often do kinetic acupuncture with. So I place the patient in a stretch. While they're in the stretch position, I insert the needles, and this one can often get rid of that nagging pain like very quickly, right away. So this stretch can be performed with kinetic acupuncture. As most stretches, I think all stretches can truly be performed with kinetic acupuncture, and quite often you'll get good results on that first try. So this is the cross arm stretch. Don't forget about this one for any kind of localized pain along the medial scapula there, and for the peripheral nerve impingements. And don't forget you can do kinetic acupuncture on the area of soreness, the ashi points. Okay, and this neck and shoulder stretch kind of puts us in the realm of crazy neck stretch because it's a funny looking position, but it's not as dangerous as the real crazy neck stretch. So this neck and shoulder stretch, it stretches the trapezius as well as the supraspinatus and infraspinatus muscle of the shoulders. And there's two parts to this stretch. The first is the shoulder. So hand is you step on the hand. So the hand is stepped underneath the opposite foot. So in the first picture, you'll see my left foot is stepping on top of my right hand. And in the second picture, you'll see my right foot is stepping on top of my left hand. This is going to provide traction. So with traction, you can lift the shoulder, shrug the shoulder upwards against the resistance of hand underneath foot. This is an isometric stretch. This stretches the shoulder rotator cuffs. And then with the neck, and this is from TCT. This is the TCT stretch number 4 that we showed you in the prior video, where we're doing traction on the one shoulder, and then with the other hand, we're cupping it behind the neck and pulling. So this is from the TCT video, where you reach behind the head turns in the direction of the reaching hand, and the chin pointed down at the chest. So you'll see that on the first picture on the left side there, my left hand is reaching behind my head, and my head is turned in the direction of the left hand with my chin pointed in the chest. In the picture 2, you'll see my right hand is placed behind my head, and my head is turned in the direction of that pulling hand, chin tucked to the chest. So neck reaching behind head turns in the direction of the reaching hand, chin pointed down at the chest. Pull in this direction. Perform both these shoulder techniques and the neck pull at the same time. So this is a self-stretch for neck and shoulder and supraspinatus and the rotator cuff muscles. Should feel pretty good. You can try this out on yourself before trying out on your patients. This concludes the video chapter for neck and shoulder Vertex using Korean kinetic acupuncture and VST. We're going to move on now to the legs with the calf muscle, knee, and lower back. That'll be the subject of video 3.